Good afternoon. And today we have a pleasure of interviewing Air Avant Medical CEO, Mr. Xavier Collazo. Mr. Xavier Collazo going to tell us about Bongo. And again, we appreciate all our audience. If you had experience with the CPAP machine and you want to try something different, what's going to work just like a CPAP machine, but without straps and long hoses, and you can sleep on any side. You can put your questions in the comments, and we're going to find the answer for them. This way, we're going to make you familiar with the technology of Bongo. And also, if you have trouble sleeping or sleep next to the snoring partner, please click like and share button. This way, you can help them to sleep better. They can find a solution on our channel. If you are a medical professional and you want to find information about adjunct therapy, how to help your patients to find the right solution, because you have to remember, not one size fits all. You want to find different modifications of the treatment for obstructive sleep apnea or just upper respiratory resistance syndrome. Please use our channel as a networking ground. This way you can connect with the other medical professionals who are just like you, very passionate about the world of sleep medicine. So again, good afternoon, Mr. Xavier.
Hello, everyone. Thank you for joining us. My name is Javier Collazo. I'm with Avant Medical, and we are the developers of the Bongo RX device for treating obstructive sleep apnea.
Thank you very much. I'm going to tell a little story behind Bongo. This is my story, what I face every day in my practice. As you know, I see a lot of patients who come to me by the referral from medical doctors. And the main reason they end up in my office because they cannot use the CPAP machine. And it can be a lot of reasons. Most of the time, to tell you the truth, they don't like that image. They don't want to sleep with something on their face and not be able to turn. Yes, that's one story, but for the partner to perceive them with that machine, they find that image very unsexy. So I'm really looking for some adjunct therapy, what I can, they can still breathe it, sleep at night in the same time, but they don't need all these parts what make them uncomfortable. And I come across Bongo. I come across this particular technology, which works similar to CPAP machine. And we're going to find out more about that, but it doesn't have any hoses. And it looks just like this. And now I'm going to ask you, Xavier, tell me what Bongo is.
So Bongo is a device for treating sleep apnea. It is not CPAP. It works off a technology called EPAP. So EPAP stands for expiratory positive airway pressure. So it's a very small device that you simply place into your nose and you breathe. And your breathing actually activates the device. The device does not have batteries. It does not have power. It does not need electricity. There are small valves inside the device that open and close as you breathe. And I'll go over a little demonstration of that here shortly on how that works. But that opening and closing creates a back pressure when you exhale, which is the mechanism of action. Basically, is what keeps your airway open when you're using the Bongo device. In our background, we came from the CPAP mask world, and we felt the same thing. There was so many patients that were stopped using their CPAP or wouldn't even fill their CPAP prescriptions for all the reasons that you mentioned. And we wanted to create a device that was very simple to use, really matched with the patient's lifestyle. But the product had to be safe and effective. So we developed the Bongo, which is a FDA cleared device. That means that the FDA reviewed all our study data, materials data, our clinical study that we did to show that the device actually reduces the patient's AHI. And that was a big part of all the work that we did before. So I'm going to go over the Bongo. I think it's just best to demonstrate how it works and what it looks like. It's very small. As you can see, this is the Bongo device. It has, it's a little bit out of focus, has very soft silicone inserts that you put into your nose here. And I'm just going to wear it. It's very easy to use. You can put it on in the dark. So I'm wearing it. It doesn't need any headgear. You can see it dilates the nose a little bit, pushes out the nares a little bit. There's no headgear that's needed. There is a headgear accessory if you want to use that, but that's it.
This is wonderful. But I have a question for you, Xavier. Why it called Bongo?
That's a great question. So it's actually, it's a funny story. When we were developing it, we started to call it Bongo because it looked like a little set of bongo drums. It's very small, and that was our internal name, and we got really great reception from it when we showed it to people, and the name stuck. And we wanted to do something that was a little memorable, a little different, because it is while it's a serious medical device, it's we wanted to make sure it had a real user-friendly and user appeal to it. So this is the Bongo. It's really small, very simple to use.
No, I want to, again, I want to explain to our audience, and again, for our listeners, if you have any questions, please put them in the chat box. I want to, again, to bring that diagram, what you breathe in, and I guess it's a little bit harder to breathe out.
Yeah, so I'll put it back in, and like I said, it's very simple. So when I inhale, there's valves in the device that open up and let you breathe in normal room air. There's no resistance there. And then as you exhale, those valves close. So that forces all the exhaled air out through very small, precisely sized, precisely designed vent holes. And that creates, in essence, a back pressure. So it's similar to what CPAP does, where it creates a positive airway pressure, but we're only doing it on the exhalation part. And that positive airway pressure carries over into your next inhalation breath. It's a really, really quiet, very simple.
But I just want to, for our audience, it's like you have to really work hard to push the air out.
No, it's very simple. With the way we designed it was, we just wanted to create enough back pressure there for the product to be therapeutic, treat the sleep apnea. But no, it's, there is a little bit of resistance there. When you exhale, it takes a little bit of time to get acclimated with it, just like any other therapy. But
yeah, no, that's very interesting. Now that's a question: how people who are interested in getting Bongo device, how can they get it?
Great question. Well, it is a prescription device. Any device that's intended to treat sleep apnea requires a prescription. So you would talk to either your local doctor, your local dentist about the device, or you can go to our website, bongorx.com, to see some telemedicine options that are there. So the first step is get a prescription for the device. Once you have that prescription, the next step is to go to you can go to either a local home medical equipment or durable medical equipment provider, HME, DME, that's somebody who normally would stock a CPAP equipment, CPAP mask, whoever, if you come from the CPAP world, where you fill that, you can get the device there, or you can go to our website again and look for a list of stocking providers that carry the Bongo. Once you get your device, and you do have to give them the prescription, they'll need that to fill it. Once you get your device, you simply you take it home. There's no the unit that everybody we have an all sizes starter kit, which is this device here. It has 4 different sizes: small, medium, large, and extra large. So you can take your time at home finding what size is your preferred size that's comfortable and seals for you, and just do that at home. There's no fitting at the store or with a doctor. Everything you need is in that kit to get going. And online we have videos. We have the instruction manual of the product that you can use for tips, for how to get acclimated to the device.
Now I'm going to ask you my favorite question. Yes, it's a prescription device, but does insurance cover it?
No, the Bongo is not covered by insurance. A lot of the CPAP alternatives, like the Bongo, are not covered by insurance. But if you look at what you spend on CPAP supplies, either through co-pays or your co-insurance, what you owe on your deductible, you may see that, the Bongo price is actually less than what you spend out of pocket for even your covered CPAP supplies.
Can you
Also,
give us an idea?
yeah, if you have like an HSA or FSA, one of these health spending accounts, the Bongo is a prescription device and it does treat a disease. So you can use, funds from those healthcare savings for a device like the Bongo.
But what preliminary, like I don't want to exact number how much DME sell it for, but I think for my audience, it's important. What money are we talking about to have, at least a starter kit?
Yeah, the starter kit is so it retails for $199. We don't sell directly to patients. There's the DMEs or the online stores are the ones that sell the device to the patients. That product comes with the 4 different sizes, as well as some accessories that come with it. There's a travel case that's really nice. There's a drying stand that you can put your Bongo on to help the product dry after you wash it and clean it. And also there's a optional headgear. So if you're a very active sleeper or somebody who tosses and turns a lot, you can use this with the Bongo to, help facilitate keeping your nose. The headgear is not needed to create the seal. I just want to point that out as different than CPAP. You could basically inserting the device into your nose creates the seal and the securing of the device.
Just as, I understand those, straps needed not to lose it in bed. Right? That's basically at night. And yes, thank you very much for your questions. For our listeners, the same question what I asked if it's covered by insurance. It's a very important question for me and for my patients, of course. But I would like to know, and I want to confirm it with you, if somebody get a prescription from their doctor and they use Bongo, do they have to check the efficacy with a sleep study?
Yeah, we recommend that. Also, for any sleep apnea treatment, that it's good to follow up with your doctor for it. Your doctor, there's different options. They may ask you to do sleep diaries. They may ask you to do a Epworth sleep test to measure daily, daytime sleepiness. And there's also, there are other alternatives, whether they're some of the watches or the rings or some other things there. There's apps as well. So there's different variations of that you could talk to your doctor about, but it is something we do recommend for you to do, once you're on any sleep apnea treatment. Follow up with your doctor, super important.
Now I'm going to ask you a lot of tricky questions. So please tell me, this is again story from my practice. I notice what a lot of my patients, when I ask them how do they breathe, I assume to use the Bongo, you need to use your nose, and preferably nose exclusively. That's my song. That's why I love everything what related to the nose hygiene, all of that. So if patient tells me but he used both nose and the mouth, I assume they breathe through the mouth because it's so much easier to breathe through the mouth. And I usually tell them you can breathe through the mouth as much as you eat through the nose. But, people don't get it as a joke. They said, I breathe both. So please tell me, if somebody does not breathe or breathe both, can they use Bongo?
Yeah, I agree with you with what you said. I mean, it's super important to breathe through the nose. I mean, that's the purpose of the nose is to humidify and condition and filter. It's the body's filter. So very important. So we recommend a few things. So during the daytime, if you have issues with breathing through your nose, there are things out there like Navage and other things like that you can do to help flush your nose. So you can, use a product like the Bongo. If you come from the CPAP world and you used a nasal mask or nasal pillow type device, you'll have no problem breathing through the Bongo. But we do, it is important to use, to breathe through your nose while using a Bongo. It also, the Bongo does dilate the nares a little bit. So it's if you think like of a breathe right strip that pulls the nostrils out a little bit, this does it from the inside as well. So it is a nasal dilator as well as an EPAP device that treats the airway splinting for the sleep apnea.
And I have it also very common in my practice. Then I talk to the patient about nasal breathing. And I'm going to repeat myself. I always talk about nasal breathing because inside of our nose we have that magical gas called nitric oxide, and it's actually help you to dilate your vessels, prevent the stroke and other cardiovascular adventures what you definitely don't want to get yourself into. But it's also that specific gas help you to dilate your turbinates, to make your nose cavity bigger. More you breathe with the nose, more you can breathe with the nose. So a lot of patients answer back to me. They said, but I have a deviated septum. Now, let's talk about bongo and deviated septum. First of all, is it a contraindication to use bongo with deviated septum? Or what's bongo Iravant company opinion on deviated septum and bongo?
Well, as I mentioned, so since the bongo does dilate the nares, it does push out the nostril a little bit. If you have on the side that's deviated, opening it up a little bit on that side as well. But we do have, if you can at least breathe through the one of your nostrils, there's valves on both sides of the device, so you can get the sufficient air that you need while you're breathing. So it's and also the these are very, very flexible. So they will, even though they're shaped elliptical here, they will reshape. They're very soft silicone inserts. So they'll reshape if your nostril is kidney shape size or circular. So it'll conform to your nose.
Very nice. I have, again, back to contraindications and side effects. Very common question. People want to know what's the contraindication, to use bongo, and what would be the side effect if they use bongo?
So the bongo is cleared for mild to moderate obstructive sleep apnea patients. So if you're a severe sleep apnea patient and you're only using the bongo, that would be a contraindication. If you are if you have severe comorbidities, severe heart disease or severe respiratory ailments, emphysema, severe COPD, that would be another contraindication for the device. And if you're somebody who's just like you mentioned, a severe known mouth breather, can't breathe at all through your nose, then that would be another one as well.
Got it. But you didn't see any side effects for people when they use bongo?
No, we introduced the bongo in late 2019, and we have not had a single reported serious adverse event with the device. So it's very easy to use. It's very safe. If as you're getting used to the device, if it feels uncomfortable, we say just take it out and try again the next day. It's very, very simple.
And again, we appreciate all our listeners. Please put your questions in the comments, or if you listen to us in the recording, you can put again in a comment and we find the answer to your question. Now I'm going to tell you the story what I face in my practice. And I want to ask you if I can help my patients with the bongo. So very often patients come to me, they don't want to use the CPAP. I'm so excited. I'm going to help them with oral appliance therapy. And all my patients, they instruct from the start. I'm going to get them the oral appliance device, and then they're going to be sent back to the physician to check the efficacy of my treatment. That's kind of the exam for me. And as being a student all my life, I don't like to get an F. And very often I do get an F on a sleep study. I don't like to get those sleep study. I see the sleep study. Yes, I helped, but my A have to be below 5. HI have to be below 5. And I would like to ask you, please tell me, Xavier, can I use bongo in conjunction with oral appliance therapy? And what would be the proper way to introduce it to the patient?
Yeah, so the bongo, since it's all above the mouth, it's out of the way of any oral appliance. So we do know of some patients as well as dentists that are using both the bongo and the oral appliance. So they might try an oral appliance. They have, say, a severe sleep apnea patient, and they reduce their AHIs only down to a certain level, but they want to continue to help that patient. So they're doing a hybrid or combo therapy where they're also using the Bongo to further bring down that patient's AHI levels or reduce their sleep, their apnea events as well. So that is something that is being done out there in combination with oral appliances.
So my patients who got an F, or I got an F on the test, we have a hope. I usually talk about combination therapy, but for a lot of patients, I talk about combination therapy, CPAP and oral appliance, and they don't want to hear the word. So that's the hope. I can introduce them to Bongo. But tell me, Xavier, how patient can prepare themselves to use Bongo at night, what they can do during the day. Because for a lot of people, night is a very intimate business. They want to sleep. And tell me what recommendation you can give to my patients, what they can do to sleep well with Bongo at night. What can they do during the day?
Well, I went over a few things about, whether it's flushing your nasal passages, obviously like anything on the sleep apnea side, alcohol, anything like that. Just make sure you give yourself enough time to rest. The Bongo is pretty easy to apply. You saw how quickly I could put it in. So it's not a lot of preparation time there right when you're using it. But we do recommend, especially when you're getting used to the device, just to know what to expect. You're going to feel a little resistance when you breathe on it. That's normal. That tells you the device is working. When you actually wear the device at night, don't do anything active, because that's going to force you to breathe through your mouth. Just sit down, relax, maybe watch TV, read a book, especially when you're getting used to the device.
With the Bongo.
Yeah, and just getting used to the product. But those would be our main recommendations.
I just want to rephrase, Xavier, if you want to have a successful night, I think it's a good idea to prepare yourself during the day. And I brought this slide on to show you different sizes. Like you start with Bongo and you can try in your starter kit, you would have small, medium, large, and I guess, or extra small, extra large, and you can try which one you find the most comfortable. And just like I recommend that to a lot of my patients, I suggest to use the device during the day. And if you find Bongo is difficult, you can use some other nasal dilatator to get that feeling of having something in the nose. And this way you can have your intimate experience at night with Bongo without interruption. So we have another question from our audience. Thank you very much. Please tell me, prescription for Bongo can be also from the dentist, or it has to be only from medical doctor? Thank you very much for the question.
Yeah, the prescriptions are from a dentist, for a doctor, nurse practitioner, physician's assistants, anybody who's working in the sleep field that can write the prescription.
And tell us, Xavier, what's the cleaning routine with Bongo?
It's very, very simple. You clean the device daily simply with soap and water. The device doesn't have to be disassembled. So it's a very simple. Just you rinse it, soap and water, and then you just let it dry.
And tell me, how long a patient can use single? We have that question from our audience. How often do you need to change device for the new one? And thank you very much. Our listener wanted to know what's the maintenance for the device.
Yeah, so the only maintenance is just to wash it daily. That's it. After you use it, and we recommend that you change it out after about 90 days, so about 3 months worth of use, just to maintain that optimal performance of the device. So we recommend, and we do sell resupply packs for the device. Those come in either 1 unit or 4 unit packs. So if you want to buy like a year's worth of Bongo replacement units, you can buy that replenishment kit. So, but that's our recommendation is every 90 days. And if you're someone who doesn't use it very often, maybe you only use a product for traveling versus an everyday device, then you're not having to change it out as often.
Oh, that's actually, I want to bring it up. A lot of people complain on the CPAP because if they want to travel and they travel to the places without electricity, CPAP become a big problem. So with Bongo is so much easier. But I want to ask you again, I know it's a repetitive question, but a lot of patients come to me and they talk about deviated septum and stuffy nose and nasal obstruction. You know, they find they being allergic from time to time. So how, like, if you can get us, daily routine before they can use Bongo at night.
Yeah, I mean, if you have severe congestion or nasal obstructions, yeah, I mean, some of the things that we talked about, and I know there's other sprays and things out there as well, but lavage, cleaning it, the Bongo does help to dilate the nares to open up those airways, just as like a mute internal dilator or breathe right strip, which a lot of people use for allergies or nasal congestion. The Bongo, in essence, it is a nasal dilator, so it does that. It does it internally. As well. And if there's anything that worked for patients that were either using a nasal mask or a nasal pillow that were doing CPAP, if whatever they're doing that worked well there for preparing them for using those types of products at night, the same routine is what we would recommend for the Bongo.
And I'm going to ask you the question from our audience. If somebody, we have a lot of people in our audience who sleep next to the snoring partner. And that snoring partner, resist to do anything, to stop the snoring. Can they use Bongo? Would it help with the snoring? Or how they should design the strategy to convince the loved one towards Bongo? Like, it's a little bit long, but it's a Valentine's Day question. A lot of patients did yesterday. Happy Valentine's to all our audience. And, that's the Valentine's Day question, because sleeping in the same bed is very important for our well-being. If you're in a partnership relationship. No. But if you have a partner, it's nice.
Yeah, usually it's the bed partner really is always the one that tells people, hey, you're snoring, or heard something. I'm concerned about what I heard at night. So it's such an important source for how you're sleeping, at home. So we recommend that well, I'll tell you a story real quick. So when we were developing the device, I wore it for a month straight at home. And my wife had no idea I was wearing it, because it's so easy and discreet. I was putting it on in the dark. Outside of that one day, she said, I've noticed you're not really snoring as much as you used to. So we designed a device for treating sleep apnea, but patients, and including myself, reported that it does help with the snoring aspect as well. But that's, I say, it's not the primary thing, but you should notice some reduction. May not eliminate snoring completely, but you should notice some reduction of some sound as you wear the device. But the most important thing is to use a product for treating the sleep apnea, which is the key thing. And that's why we developed it. We developed for people who don't like CPAP, won't use CPAP. Patients, maybe they use CPAP but want to travel, as I mentioned. Don't have access to electricity. Maybe they live in a different country, or they live off the grid, which is, the people are doing these days, or like the camp or RV, and also for, most probably for new CPAP sleep apnea patients that have mild to moderate obstructive sleep apnea. They're just really hesitant to try anything else. So they've tried other things that didn't work for them. So it's a wide range of people who would consider a product like the Bongo.
No, that's the fantastic thing. I really like what, not one size fits all, like with the CPAP, what people can have a variety, and maybe for certain period of life, it might be the CPAP, for certain period of life, it might be oral appliance, for certain period of life might be Bongo, and it can be myofunctional therapy. So you go through the life, not close-minded. You have options. you can make your health better, and we have a design for you. So thank you very much, Javier, for being our guest and answering all the questions about Bongo. And I'm sure people would benefit from this knowledge. And if they have questions, they can put comments in the box and we'll find them the answer, and they can talk to the physician and use your interview as a source of information. So thank you very much. We're looking forward to see you again.
Yeah, thank you for having me. I appreciate the opportunity to share about our product.
Thank you.